Good morning, Representative.
Morning, and thanks for letting me come testify. I think, I've become obviously a lot more interested in this issue than I had been, and I think it deserves more interest from, this body, because I think we can do more than we have done in the past. And I think, I was just going, before I say what I'm going to say about the taxes, the cigarette taxes are very retrogressive. We're taxing the victims of addiction. We're taxing the victims of these, both the tobacco companies and our somewhat neglect in doing what we could do or should do. So, but on the other hand, we are addicted to that money. We've become addicted to that money as well as they are addicted to their cigarettes. So I think that income stream is going to have to continue, or at least be decreased gradually and not suddenly. Like my ban was trying to decrease it gradually, but I guess it was a little too much. Anyway, so bans do work. We have the federal ban of 18. Last year we banned it at 21, and I think we need to consider increasing that ban, and that's what I'm proposing today. And I had an amendment to do that, which amends this current bill, the first part of it, actually. So, despite decades of struggle with the tobacco industry and the laudable reduction of the percentage of adults that smoke cigarettes in Hawaii from possibly over 50% at one time to possibly less than 15% at this time, according to the England Journal of Medicine, cigarette smoking remains the most important preventable health hazard in our society and in this state. In addition, we now have the rise of the use of e-cigarettes, which, while initially giving hope to those who thought this was a non-carcinogenic nicotine delivery system that could wean smokers off of combustible cigarettes, instead has spawned an exploding epidemic of vaping among teenagers. So, Hawaii passed a ban on sales of cigarettes and e-cigarettes to those individuals under 21 years of age last year, but the vaping epidemic has not noticeably slowed. One of the major concerns is that the level of nicotine inhaled from electronic vaping devices is actually higher than from cigarettes. So, if nicotine is causing a problem, nicotine is causing more of a problem from electronic cigarettes, not less. It has been shown that many of the negative effects on women's reproductive health and the health of their fetuses and babies is mediated not by the carcinogenic components of cigarettes, which vaping devices largely lack, but by the nicotine contents which vaping devices have in higher levels. The Institute of Medicine looked at 3 age points for age of purchase of cigarettes limitation, 19, 21, and 25. 25 would be the best in terms of affecting the most people, decrease the initiation of cigarette smoking, and limiting the availability of teenagers by even more restricting the social circles that might provide cigarettes to young individuals who could not purchase cigarettes or vaping devices on their own. Another serious concern is that nicotine has its most severe effects on women in the reproductive years, as reinforced by a study published just recently, which I gave you a copy of, published March 3rd or thereabouts, 2019, showing that 22% of the sudden deaths of babies, not fetuses, in their first year of life, in other words, sudden infant death syndrome, was due to the effects of their mother's smoking during pregnancy. So even if the women stopped smoking, their pregnancy smoking killed their babies in the first year of life. And we aren't addressing that. Another serious concern is that, thus raising the age of purchase to 25 for both cigarettes and vaping devices should be strongly considered for Hawaii. California followed Hawaii's lead in raising the age of purchase to 25, and if California followed Hawaii's lead again, many more lives would be saved, and many more states would likely follow that path. We therefore propose raising the age of purchase of cigarettes in Hawaii to 25 in our state, and we also propose raising the age of purchase of vaping devices to 25. We agree with this bill's intent to institute more severe penalties for those sellers who violate the law and make the companies and not just the sales clerks or cashiers liable. So I don't think we should penalize the purchasers for those between 21 and 25, nor punish possession for those ages, but focus solely on the sellers. And I have some further comments that I added to that. So I think the taxes are working, as the Surgeon General says that. But, what really also works much more efficiently is banning. Our state is so isolated, it's very unlikely there would be any, black market like you have in New York. They bring cigarettes from South Carolina. We aren't doing that. The military is very against smoking, and they went along with our ban of 21, and they would go along with the ban of 25. So we're helping our soldiers, not hurting them. I think this is something we really strongly should consider, because this is another arm of our armamentarium that we haven't been addressing as robustly as I think we should, and we're down to a level of smoking where the political blowback from voters, which I've been getting, of course, wouldn't be enough to knock us out of office. So anyway, thank you for allowing me to testify.
Well, a comment first and then a question. You appear to dismiss the reality of a black market, and people after a particular price range will not do it, or a particular health warning, they'll still do that. That's a comment you can respond to, or just let it go.
Sure. No, I think the tobacco industry actually raises that boogeyman of black markets while actually instituting black markets throughout the world themselves. So, black markets are there, but from what I've been able to tell, we do have a robust enforcement arm for the tobacco settlement people, and they don't seem to think that there's a robust black market here at this point, nor, considering our geographic isolation, is it likely to happen. The internet is an overblown source. Amazon doesn't sell cigarettes, for instance. And I think while there'll be some trickle of cigarettes in, if you put a barrier, you can't go down to your corner store and buy cigarettes here for $25. You're not going to necessarily go on the internet, especially if you're pregnant and people are telling you not to smoke.
Representative Creagan, both you and I are former Peace Corps volunteers. We've been in many third world countries, and I've been in the UN, where many places in Africa, they actually break into warehouses to steal cigarettes or bring them across the border. The black market is alive and well in the third world.
Yes.
And I know this is not going to be Hawaii, but the black market is,
right.
is a very
No, I agree. In third world countries, because cigarettes are so valuable, because they cost so much.
But we don't know what level in the, quote, first world that there would be a black
market.
Like my constituent said, I'm going to go on the internet and do North Carolina or whatever. But my question
so I think, go ahead.
Is a restatement of before, because your ban would say of the following products: no cigarettes, cigars, pipe tobacco, chewing tobacco, snuffs, and whatever SNUS. Snus. That's not snuff.
No.
Okay, whatever that is. Or electronic smoking devices, the vaping ones. As a residual of the last testimony, my colleague said, well, smoking is smoking. Well, why is not something that is, according to some of us, harmful, not in this? In other words, marijuana gets a pass. So you can smoke anything but marijuana and not you'd be penalized, but if you smoke marijuana, you don't get any penalties. Is that because it's a contravening variable of other policy issues?
I think we're adjusting our past issues and its effect on, disproportionate effect on some minorities and putting people in prison. But I think if you look at the substance of marijuana smoke, it's going to cause the same or similar level of cancers as cigarettes if people start smoking it heavily. The problem is because it's illegal, there hasn't been any substantive research addressing that. So in the future, I think that, non-combustible ingestion of marijuana is going to take over from smoking, because the carcinogenic in marijuana smoke are very similar to those in cigarette smoke. So there's very little doubt in my mind that it causes cancer.
So the data is still out, but it's likely to be coming.
Yeah, but the thing is, even in non-combustible cigarettes, e-cigarettes, you have a very toxic substance, nicotine, whereas in marijuana, you don't have the same thing. THC is not very toxic. In fact, it's the prescribed substance. Marinol is THC, and it's only a level 3 substance. So nicotine is not even on the schedule, but it should be. It's so addicting. They say it's as addictive as heroin, but it's never been scheduled, even though it is a medication.
And thank you for the study for maternity risk.
Yeah, I think that, maternity risks happen now. Lung cancer happens 20 years from now, and that's part of the problem for people, adults. But we are killing babies right now by allowing them to smoke.
Thank you for your enthusiasm and passion for this issue.
No, well, thank you for asking.
Beyond 100 years.
Yeah.
Representative, thank you very much. Appreciate you being here.